National cracker.
This is my favorite time of day.
Water crackers.
You put a smile on my face.
Rolling crackers.
You're Jamaican. You're number one.
National crispy cracker.
Come on, enjoy it every day.
Island cream cracker.
You can have it in so many ways. Oh, you make it a perfect Jamaican moment when you make it national.
Talk Up Youth, brought to you by National Baking Company, a Stanley and Empress production.
Can you imagine, from all the abuses and injustice faced by our youth today, sexual abuse, drugs, crime, depression, I am still alone. Healing, can I rise again? Talk up youth, 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 talk up youth.
Hello, my youths. It's not time to talk up, it's time to listen up. Youths, know that education is the key and knowledge is power.
Welcome to Talk Up Youth, where we create a space for our young people of Jamaica to talk about the issues affecting them and how they have overcome. And most importantly, the solutions they have found. Why the solutions? To make the masses aware and show that no matter what the obstacle, you can still live a meaningful life. Now, what would you do if your child were in 5th form getting ready for what? CXC, and then BAM! Life unexpectedly throws you a curveball called lupus. What is it? Never heard of it. Well, TUI will make you aware. So today we speak with Shoya Gay Grant, who has lupus, which is a chronic inflammatory connective tissue disease. I am not the medical news. I know that it affects the joints and many organs. I'm not the medical news, including the skin, the heart, the lungs. I'm not the medical news. Let's talk to Shoya Gay, who can inform us more about what is lupus? Welcome to TUI. How are you?
I'm okay.
All right. First of all, the people want to know, what is lupus, your condition?
Okay, in simple terms, you know, the body has white blood cells that should fight bacteria and protect us, right? But with lupus, the white blood cells are overactive and they're kind of like confused. So they don't know what's good and what's bad, so they start attacking everything. So your healthy joints, organs, tissues, and so on.
Okay.
Yes, it can affect anywhere. It
can affect anywhere and anybody?
Anywhere.
Tell us about your life.
Okay, well, I was diagnosed at 17 when I was just about to do CXC. Lupus has affected my kidneys and my heart. I have arthritis. I have this heart condition called mitral valve prolapse, and I have kidney problems. Yes, it mostly affects my joints too. I feel a lot of pain all the time. Sometimes worse than others do.
Okay.
So.
Well, that's a whole lot for, and how old are you? 17? A 17-year-old.
Yeah.
Okay. Tell us about the different ways it affected you in your life.
Okay, well.
School.
Yeah. Social. Well, for social, it showed me who my friends were, because some of them just gone with the wind, while others were there all along. I remember a couple of my friends and my sisters that would walk from Alpha to KPH every day to look for me, because they didn't have no money, but they would still walk to come, you know?
So you were hospitalized?
Yeah, I was hospitalized. Yeah, I was in there for a good while. In terms of school, it made it really harder to study, because it's hard to study through pain and through a lot of things going on. Just the fact that I have lupus, I have to live with it. It affected me psychologically, you know. It's hard.
Let's go there, psychologically. I mean, what were you thinking? How did it affect you psychologically?
Okay, first of all, when I just got lupus, I thought it was more a numb thing, maybe to protect myself, because I couldn't believe that I had lupus, because they suspected it was lupus, and then my family doctor, she told me that maybe it was, then she tested me for it. So I looked it up, and there were a lot of negative things about it, you know, susceptibility to heart attack, stroke, organ damage, all different things. So I was thinking it wouldn't be it. You know, I was praying and hoping that it wouldn't be it.
Yes.
But then when I found out that it was indeed lupus, at first I couldn't allow myself to feel anything, because I think I wasn't prepared for it.
You went numb.
I went numb. But after a while, you know, it was hard. I was sad, of course. I didn't know how to deal with it, partially because I was so young, and it was just too much at the time.
How sad did you get?
Very sad. I think.
I want you to share it because, you know, there are a lot of people going through.
It's just that I'm just learning how to express the psychological part.
Yes, okay,
Yes.
no problem.
Yeah, but overall, I was really, really sad. I was down sometimes, even though it didn't show on the outside. I was scared and I was angry because I feel robbed, cheated. I was 17. It's hard to go up the stairs because I have arthritis. I shouldn't go in the sun because I'm going to get rash. Everything that I used to do, like some stuff that were once easy for me to do, get up out of bed, it was no longer easy, and I felt like I see my sisters jumping out of bed doing what they're doing, and within myself, it was hard to know that sometimes I'm at the bottom of the step because I live upstairs, downstairs.
Yes.
Yeah, I'm at the bottom of the step, and it would take me like 5 minutes to go up, and it's just a couple of steps.
Right.
But so there was a lot of internal anger. And there was fear. Like every time I tell somebody I have lupus, they're like, you know, I know somebody who have lupus, but them dead. You know, like that.
Okay.
So there was a lot of fear and anger and sadness.
Yes.
Like, why me? Why?
Were you ever discriminated against because of your condition?
I can't remember, not really, except for there was this one time when my first year in UE, when I got really sick and my immune system was really, really down. I had to wear mask and gloves to school.
Really?
Yeah, so that I don't catch anything.
Oh.
Yeah, and then everybody started treating me like I had some contagious disease, and like I would sit down in the lab, and
What were you studying?
I'm studying psychology.
Oh, wow. Okay.
Psychology and criminology.
Okay.
Yeah.
So you're in the lab now.
I'm in the
Gloves,
lab.
mask.
Gloves and mask, and there are computers going across in the lab. When I sit down in one room, nobody goes in the seats that's in that room. And then, like this girl, she rushed in, and she didn't notice that I had on the gloves and the mask. So she started doing her thing on the computer, and then she looked across and she was like, should I be sitting here?
Oh,
You know?
yeah.
But other from that, I haven't been discriminated against. Yeah, but
So how do you inform your peers about this, and when you do? Because, I mean, lupus is something that not a lot of people understand what it is. So is it that there needs to be more information? I'm just saying, you know.
Yeah, I think lupus awareness is really low, especially in Jamaica.
Yes.
So what I do is I talk to my friends.
Yeah.
And I talk to Yui about lupus. So like when it's Lupus Awareness Month or so, I would like in the previous years I'd ask my lecturer if I could talk to my class about it.
Okay, so to make them more aware.
Yeah.
I want to go into more about the different groups that are out there and where we can seek more information later on, but I really want to find out more of the medication that's involved, the treatment, the financial burden, you know. What happens with lupus? Is there a cure, and how do you treat it?
Well, there's not a cure, but there's treatment. Well, there are different types of treatment, but the one I'm on steroids, right?
Okay.
Well, one of the medication that I'm on is steroid. So what it actually does is, because the immune system is overactive, it suppresses the immune system.
Yes.
Right? I'm on other medications as well.
About how many?
When I just got lupus, I was on 20 something pills per day.
Per day?
Yeah. But now I'm like on 8 per
Okay.
day. Yeah.
And you have to take them on time. I mean, we'll get into that, but that's a lot of medication to be
Yeah.
on.
It
And
is
you're
a
how
lot.
old now?
I'm 22.
Wow. That's a lot to go through. How bad did it get though? The worst thing that happened during your condition?
How bad did it get?
Yeah, how
Like,
sick did you get?
the worst I got was the period in which they were trying to diagnose me.
Oh, okay.
Yeah. So I couldn't walk, I couldn't eat, I couldn't do anything. I was swollen. I was in pain. Like the pain then was like unbearable. It was terrible.
Bawling your eyes out kind of pain?
Yeah, but yeah, I don't even think I can really explain it, but it was very,
Unbearable.
it was unbearable.
Stay with us, Shoige. We have so much to talk about.
All right.
We're there upon TUI, and this is what we do. We're going to talk the positive. According to the president of the Lupus Foundation of Jamaica, this degenerative disease affects about 1 in 300 Jamaican women, and women account for about 90% of lupus cases worldwide. It can start anytime, as we heard from our guests, but mostly after puberty because it is driven also by the female hormones. I once lost a dear friend to lupus. As Shoyage said, every time you hear lupus, you hear somebody say, boy, them are got dead. But the question is, what would you do if you were diagnosed and how do we cope? Shoyage will enlighten us more after the break. We are on TUI. My youth. She doesn't know I read her blogs, but I have to read one of Shoyage's poems that I found on the internet. Is that okay?
Yes.
It was a long one, and we can't get through it all, so you'll need to go look it up, and Shoyage will tell you where to find it. But I cut together some pieces, so here's a little extra from, but I cut and paste from your poem. You are not alone. You are a teen. Your future should look bright. Yet it is almost impossible to look through all the darkness to find the tiny beacons of light. Teenage years are not filled with adventure, risk, memorable experiences, and lessons learned the hard way. Medication, sunscreen, fatigue, aches, and pain. Those are what make for an ordinary day. As an army, we can overcome great obstacles. I am not, we are not. No, you are not alone. Tell us about that poem.
Okay, that was for Lupus Awareness Month last year. The theme was You Are Not Alone, because even though it's good to try to promote awareness, there are lots of things going on within the lupus patient, you know? And a lot of times, because awareness is so low, you actually feel like you're alone, you're going through this by yourself. But that poem was just written to my readers to tell them that we're all in this fight together, my fellow lupus warriors. You know, I understand how you feel, I feel what you feel. You're not alone, you're not alone, you're not alone, you're not alone.
And is it that lupus is not really visible? Is that also what it is?
No, well,
Makes it hard for people to really understand it?
sometimes, because there are different types of lupus. And for SLE, that's the one that I have.
Yes.
That's the one where lupus attacks the inside.
Okay.
But you have something called discoid, where lupus attacks the skin. So that one, it's visible. But for the SLE, it's not.
It's not really.
Sometimes, unless you have like a rash or something, but it doesn't really show on the outside.
Okay. What are the positives that you've seen since your diagnosis? I mean, how has life changed? How have you been enlightened? Or how have you enlightened others?
Okay, well, you know, a lot of people might think that having a disease, there are only bad things that can come from it, but that's not true. Because lupus has taught me a whole lot. First of all, it has made me grow and mature. It has changed my perspective on life, totally. Like, I remember before I was a little bratty, a little selfish. petty. The girl that would malice the other girl and you don't remember what you malice her for, and then you would walk far from her for some stupid things. Like, it changed my perspective. The petty things didn't matter anymore, and I started to see like the more important things in life, like your family, your friends. It doesn't matter if somebody hurt you, you can still be friends with them. Those things. It helped me to grow spiritually as well. Like, I was born in the church, but I didn't really find God until I was diagnosed with lupus, right? After that, our relationship grew, and it's more intimate.
Why is spirituality important to guide you in life?
All right, if you don't have, well, it was important to me because it brought me hope. It brought me hope. It brought me hope. It brought me hope.
Okay.
It brought me hope, and it gave me a meaning for all of this. Like, I'm stuck on Job, right? And Job going through all his troubles and knowing that God knows what we're going through, and sometimes it's God himself that allowed the situation to happen to test our faith. But if we persevere, we'll have this hope that, if it will turn out okay, something external to hold on to. Because honestly, if you don't have any hope and you have all these things facing you, it can be overwhelming and hard. So spirituality gives you hope, and it's like a coping mechanism.
Yes.
Yeah.
And what about family?
Family.
Are they helping you cope?
Yes, my family is wonderful.
Nice.
Yeah,
We love to hear that.
Yes, there's no other family that I'd rather be a part of.
Yes.
Yes, I love my family.
Apart from the Talk Up Youth family.
Yeah.
That's
Yeah.
that's
That's a given. That's a given.
Yeah. Okay.
Yeah. But my family, my sisters and my parents, and also my cousins and all the people, they are really, really supportive. They like my sisters would wash the dishes all the time because where we live, the water is cold, and my joints hurt when I get cold. No.
Okay.
So they would help me out when I feel in pain. They understand when I'm grumpy. And yeah, my parents, they're always there for me, getting medication or daddy rushing me in the night to the hospital or something like that.
Yes,
yeah,
yes.
They're always there.
No, some people watch it. That's beautiful, and I want to thank you to show you guys family. But some people watching be like, this doesn't really affect me because I don't know anybody with lupus. I want to focus on the lessons now. Forget lupus for a minute. Life lessons that you have learned. What are they? And I'm sure they can be applied to many areas of our life. What are those life lessons?
Okay, one of them is not to judge persons based on like outward appearance or so, because like a lot of people look at me and they're like, you're okay, you look pretty, but they don't know that there's a war raging inside my body. Like, I'm going through a lot, but a lot of people, like one time this girl said to me, boy, I wish I was you. And that's looking at the outside and judging, and you don't know what's going on. So it's even too bad or good. You don't judge people, you don't know what's going on. Another thing I learned is that everybody has a battle fighting, right? Lupus is just mine. But everybody has a battle fighting. But it's important to know that life won't stop because I have lupus. You understand? So what I have to do is I have to have an attitude to fight the challenges that come upon me, right? And that's good. Whichever situation, you don't have to be lupus. You just have to have an attitude to get through, because everybody going through something. You understand? So everybody needs to fight. Everybody needs to overcome the obstacles, and overcoming the obstacles is very, very dependent on how you choose to perceive it. So if you're very pessimistic and be like, I'm done dead already, or this not gonna work out and all of that, well, words have power. So they will self-manifest. But if you have an optimistic attitude, I will overcome this, it can go far. It can help a lot.
Can I hire you to be my life coach and counselor?
Sure.
We take a break. More on how to live, cope, and survive any medical diagnosis, any situation as a young person in Jamaica and worldwide.
national cracker. This is my favorite time of day. You put a smile on my face. You're Jamaican, you're number one. Come on, enjoy it every day. You can have it in so many ways. Oh, you make it a perfect Jamaican moment when you make it national.
Our TUI counselor, Dr. Carol Mitchell, Assistant Vice President of the Center for Counseling and Psychological Services at the IUC, is with us. Thank you for joining us.
Thank you.
Yes, I'm going to get straight to it. Dr. Mitchell, you and Shoyage have a moment to speak. What are you hearing? How can you counsel her if she even needs it? Talk to her, please.
Actually, I listened very carefully to what you're saying, and you said something that a lot of persons with a chronic illness should recognize. One, there are certain reactions that you go through. This includes denial, anger, fear, something called dissociation, which you describe as numbing. And it's all protective. It's not something that is abnormal or something that, you know, should not happen. We are familiar with these things happening in a regular grieving process, and we assume that grieving is, you know, you have lost someone,
yes.
But normally grieving occurs in any way. And in this instance, there is a loss because you have lost the kind of life that you had wanted, that you were exposed to before. So I smiled a little when you said, you know, you're going up the stairs and you see your sisters just bolting up and down and you're there. And it makes you a little angry, you know, why me? And all of that actually is totally normal. And I also thought it very telling when you said, you know, I'm just learning to express these things psychologically. And let me tell you, welcome to the field of psychology. I do hope, because you're a psychology student, right?
Yes.
I do hope you get to go on in that area, because I believe, as Empress says, you have this way, you have this personality that draws people to you. So you'll be a very good person in the helping profession. And because of your background, you have the experience that will allow you to share from the heart. Not everybody can do that.
You call it the helping profession.
Yes.
I like that, a helping profession. She's my new life coach, you know. Yes.
Earlier, say the way you think about a situation, and I hear the psychologist coming out in her, you know. The way you appraise the situation, the way you look at it. And as you said, if you think you're done dead, I believe that's what you said, then what is going to happen? The way you think about something actually manifests itself. And that is something that you have learned because of life lessons. And the other thing I like about what you have said is that this does not define you. It actually caused you to grow, to mature, because you have had to come across some challenges that I have not had to deal with, you have not had to deal with. Lots of persons have not had to deal with that.
But some are out there dealing with it and don't know how to deal with it.
And I think you are a very good example of how to deal with a chronic illness. The illness does not define you.
No, it doesn't.
You basically define how that illness manifests. Yes, it's tedious, it's painful, you have to take the medication, and the medication causes all kinds of change. And we do know from health psychology that adherence to a medical regime is not good. Yeah. So when I hear you saying that, you know, you take your medication, that is one of the big steps.
Well, that, and what kind of discipline is needed for that? I mean, did you already have that kind of discipline, or you had to acquire it?
I think I had to acquire it, because here am I being faced with, it's either you do this or you die. So you have to learn to do it. I'm not perfect at it. No. Even 5 years after, sometimes I slip up 1 and 2, but I do try my best. Sometimes I'm supposed to take it like 11 o'clock and I forget, but I take it 11:30, you know? But I just really try most times, and practice makes perfect.
So many lessons, so much advice she's giving. Practice does make perfect. All right, so where are we going now? Where are you now? Where are you heading? What is life like? Tell us all the good stuff.
Well, no, I'm in my final year at UE.
Clap, clap.
Yes, and I plan to go on to do my master's
Clap, clap.
in clinical or counseling psychology.
Clap, clap. Doc, is there a job available? Okay.
Come to the CCPS afterwards.
There you go.
Okay.
We'll link it up.
Yeah, and right now I do a lot of writing for Lupus. Yes, well, there was this Lupus magazine, an international readership, but like right now it's on pause because of something with the editor. But we're still expected to update our personal blogs as writers. They have writers across the world. So I have my own blog that I write on, and I have my readers. And I'm also the PR manager for the Lupus Foundation.
Yes.
And we do a lot of activities, a lot of lupus awareness. So that's just where I'm at. I'm at school, you know, with God. I'm trying to promote lupus awareness, trying to be a better person. So yeah, that's pretty much where I am.
We're very proud of you.
Thank you.
Thank you for making us aware. Isn't she beautiful?
Very beautiful.
Oh gosh.
I think you could end up hosting this show for me. I think I'll leave it, people. God, Shoya and gang. Thank you so much, Dr. Mitchell. Any final words?
I think what I want to take away from what Shauna Gay has said is the analogy of a battle that's on the inside, but Shauna Gay is the general. She's actually directing the army, right? And the battle is still being fought.
Yes.
But there's no lying down. There's no
retreat.
Yes, it is. It is ahead, forward, ahead. Yes. We will overcome. And as she said, she's not alone.
She's not alone. Thank you. Now to my parents watching Talk Up Youth. When your teenager has been recently diagnosed with lupus, you want to learn about the disease, its treatments, and what to expect in the future, as well as the coping strategies that will help your teenager and your family. So keep watching Talk Up Youth. Watch it all over again and again on the internet. There are symptoms of lupus, some invisible, as we heard from Shoya Gay, and some very visible. These symptoms can be of great concern to your teenager, especially those that cause a change in their appearance. You know, we can get hair loss can be involved with it, you know, being bloated and skin rashes and weight gain and easy bruising and all kind of stuff. So please, my parents, be patient as you help your teenager learn to cope both with these effects of the disease and other people's reactions and attitudes. Now, my teenagers with lupus, I hope Shoya Gay was able to be a good example of how to cope. And for additional information, go to our Talk Up Youth Facebook page where we'll give you all the tips them, is it? The key is to get information, is it? Medical support and to be supportive. Thanks for watching, because it's strictly positive. And right as we call on Stepper, big up the people them you want, big up.
Oh,
quick.
Family, friends, my sweetheart, my cousins, everybody.
Stepper, come in, man, come in.
Talk up youth, talk up youth, talk up youth. Myself fit talk up youth. My white blood cells attack me. 2 Jet Li, Chuck Norris, Jackie Chan box me. Me I go report it down a police station that I am pressing charge against white blood cells violation. A lupus do it. A lupus do it. It's unbearable, but she bear it. My white blood cells attack me. Me can't go up the stairs. Arthritis trap me. Me wear mask and gloves go a school officer. Not to mention the heart and kidney massacre. Kidney massacre. A lupus do it. A lupus do it. It's unbearable, but she bear it. My white blood cells attack me. 20 odd pills per day, steroids treatment, round the clock, tick tock, tick tock, tick tock. Friends gone with the wind. A lupus do it. My white blood cells attack me. My white blood cells attack me. A lupus do it. A lupus do it.
Talk Up Youth, brought to you by National Baking Company, a Stanley and Empress production.